Excellent. I think we're going to get started. Good afternoon, everybody, and thank you for joining us today. My name is Luis Garcia, Director of the Center for Media Innovation and Technology, and I will be your moderator for today's webinar, which is titled Health and Safety Excellence. In this webinar, you're going to learn about health and safety trends in the meat and poultry industry, how the Health and Safety Excellence Program can help you focus on the workplace health and safety topics that are most relevant to you, and how you can earn rebates on your WSIB premiums, which sounds very good. Before I introduce our speakers for the day, I just want to go over a couple of housekeeping items. I ask everybody to please put their microphones on mute to help minimize any background noise. If you have any questions during the presentation, please feel free to put them into the chat, and we'll be sure to ask them during the presentation or at the end. There will be time for questions at the end. Please use the raise hand function that can be found at the top of your window to ask a question. And when we call your name, you can unmute your mic and ask your question. Please note that we're recording today's presentation. With that, we're pleased to welcome Vanessa Blunt and Brett Christie, who will be our presenters for today. Vanessa is a program management consultant for the WSIB. She has a degree in biology from Western University and graduated with an MSc in epidemiology from the University of Toronto in 2001. She's passionate about the health and safety program created by WSIB and helping Ontario businesses understand the value of health and safety. Before joining Workplace Health and Safety Services, Vanessa focused her last 20 years in the healthcare sector, where she led program development, quality improvement, and performance measurement in private, government, nonprofit, and charitable organizations. Brett Christie is a National Casualty Risk Consulting Leader, Senior Vice President, Aon. Brett is the lead for Aon's Casualty Risk Consulting practice in Canada. He leads the development and growth of Canada's safety, health, fleet, and premises liability services. He manages risk control services for the Western Region branch offices, focusing on general practice, public entity, manufacturing, Indigenous services, and construction clients, and identifies and develops customized risk control solutions for Aon clients. I'm now going to pass the mic on to Vanessa to begin the presentation. Vanessa, please go ahead.
Okay, thanks, Luis, and thank you everybody for joining us today. Well, Brett and I are going to talk to you about investing in health and safety through WSIB's Health and Safety Excellence Program. But as Luis mentioned, I'm going to sort of start off with some stats. But before I do that, I'd like to do a land acknowledgement. So in the spirit of truth and reconciliation, we acknowledge that the land we inhabit today and on which we operate our offices across Ontario are traditional territories of First Nation and Métis peoples and the residents of many Inuit people. We recognize the past history, the vibrant spirituality, culture, and stewardship of the land of all Indigenous peoples. We are committed to reconciliation and growing new relationships, partnerships, and understanding to achieve prosperity for all. Okay, so today, as I mentioned, I'm going to talk a little bit about kind of the business case for health and safety. For those of you who think you still need to make the case, we're going to talk about the Health and Safety Excellence Program and then how you can get support and how the program kind of works. And that's what Brett's going to talk to you about from an Aon perspective. So, key question, why invest in health and safety? I'm trying to make health and safety very exciting, and hopefully after today's presentation, you're just going to be ready to go. So the first thing we're going to take a look at is, what do the stats look like from a WSIB perspective as far as what the sort of lagging indicators are? So if we look backwards, what does it look like and how can we avoid getting this or prevent injury and illness and improve the system? So if you look at the first three subsectors on the left-hand side, so we're looking at animal except poultry slaughtering, rendering and meat processing from carcasses, and poultry processing, those have just add up to about over 6,000 days lost, which is a third of the days lost for the other category that I put up there, which is supermarkets. Just for comparison, because I know a lot of you will operate storefronts as well, which makes sense that there's a lot more days lost for supermarkets because they're a lot more employed in the last sector. However, what's really interesting here is when you look at the benefits paid out, the amount, which is almost 5 million for the first three there, so the processing and soldering, compared to over 9 million that was awarded in benefits to supermarkets. But the benefits that were awarded to the first three there are, about half of what was awarded overall to supermarkets. So a little bit of a difference there. And just to note, in 2021 to 2022, 30% of claims that are part of the class that you belong to, that we're going to talk about in a second, were from sprains and strains. And you'll see that across the board for almost all of Ontario. Sprains and strains are usually the number one. So when we take a look on the right-hand side at the lost time injury rates, comparing some of the different sectors and subsectors and categories there, what stands out here is the rendering and meat processing. That seems to be a consistently high lost time injury rate in both 2021 and 2022. The good news is that animal slaughtering, which was at in 2022 at 1.48, and poultry processing at 1.39, looks like they've made some improvements, though they're still above the Schedule 1 average, which is not shown here, but which is around 1.3. So still above that average in 2022. And just to note, meat and poultry, so all those categories, animal slaughtering, rendering, poultry processing, most of those, you'll see your businesses fit into what we call a class, and your predominant class is probably E1, which is food, textiles, and related manufacturing. But some of you will also fit into another class called I1, which is motor vehicles, building materials, and food and beverage retail. So that's why those two are up there. So the dark blue line represents the class E1, and the yellow line represents class I1. So just to note, as far as what occupations are getting injured the most, 31% of claims in Class E1 were from laborers and processing, manufacturing, utilities, and the highest in in I1, which was 19% of claims were from retail, salespersons, and sales clerks. So what else can we look at? What kind of data can we look at? So to note, I just want to let you know, I didn't take this data from some secret place at WSIB. This data is all available to you on our public website called Safety Check. So on that website, you can actually check out both individual businesses' history. You can also check out provincial statistics, which is where I'm getting this. So when we look at the class food, textiles, and related manufacturing, which is again the class that you would dominantly belong to, what's happening? Where are these injuries coming from? What are you going to be looking for to make improvements? So at a higher level, when you're looking at the whole class, exposure to caustic, noxious, or allergenic substances was the number one event. That's COVID, essentially. But then if you look at all the other ones there, there's still other types of injuries happening. So you've got overexertion. So are you, lifting heavy equipment or lifting heavy things like carcasses and, your back's getting hurt? Falls on the same level, struck by objects or equipment, and bodily reaction. So that's a lot of repetitive motion, repetitive strain, maybe from cutting or something like that. So those are the top 5 events that you see here related to claims. When we look at, okay, what are the related body parts to that? So where are people getting injured and where are they putting their claims in? Again, the number one there in the sort of blue gray bar you'll see is body systems, and that is related to COVID. But following that, like I mentioned, lower back is usually in second place for the body part that gets injured the most, followed by fingers and fingernails, which probably makes sense in your environment, multiple body parts, and then legs. So looking at protecting your people, medium business example here, this is based on a real example and just trying to show you how much this can impact the rates that people actually see on your individual results on our Safety Check website. So this particular medium-sized company had lost time injuries. There were two of them. 80 days lost off work, claims costs were around 9,000, and the major injury cause here was falls. If we look at an example for a large business, again, much higher rates than you would see on average for the class there, because they had 10 lost time injuries in 2021, 85 days of work lost due to injury, $40,000 in claims costs. This particular business, most expensive injury out of those 10 was dislocation. So I talked a little bit about why else would you invest in health and safety? So one of the reasons is you want to improve your reputation. We did a survey in 2021 with Leger, and they found that 82% of people say they want to check out the health and safety information of a new workplace before starting a new job. So again, people are going on Safety Check more. They're looking at your business's history. Part of joining the Health and Safety Excellence Program means you actually get a badge that really showcases that you're committed to health and safety. And this goes up on the Safety Check website. So you can see here, Conestoga Meat Packers is actually already a Health and Safety Excellence member, and everybody can see that. These digital badges are available for your use. You could use them in storefront windows. You can create decals out of them. They're really there to show your commitment, as unfortunately COVID really raised the profile of health and safety in organizations, and especially a lot of younger people who are new or coming into the industry are going to be looking for that. So, how do businesses actually invest in health and safety? Well, this comes from a study that was done by the Institute of Work and Health. And I'm not going to go into a huge amount of detail here. Some of this probably totally makes sense to you. The first three buckets there is where most of the money usually gets invested. So, that's having people who are responsible for health and safety, doing the training, and then providing personal protective equipment. The last two boxes you see there aren't as popular or are harder to calculate, but there's professional services provided by external organizations as well as new capital investment that you'd have to sort of figure out what percentage is linked to improving health and safety performance. But when they did that with 370 Ontario employers, they found on the average the annual health and safety spending per employee was $1,300. And then you can see some of the other sectors there, manufacturing being a little bit higher than the average at 1,515. So for actually overall for the Ontario goods producing sectors, it was over 2,000, and in the service sectors, it was around 800. So then what they did is they wanted to look at, okay, let's take a look at high performing organizations and see how many of those can, what if they've invested in health and safety, are they actually benefiting from that investment? So what they tried to do is look at financial benefits, looking at what are those costs that are saved from avoiding claims. What are those indirect costs, which actually they figured out were about double the direct costs. So that's things like cost to repair or replace damaged property, material equipment, administrative costs associated with injury event investigations, hiring and supervision of replacement staff, and productivity costs, work interruptions, all those kinds of things go into there. They also try to quantify the benefits that you get from investing in health and safety from improved employee morale because you're engaged, people know you care, production quality should increase because you've made those investments in health and safety, and like we talked about, a strengthened reputation. So when you take all those things together and they looked at what businesses spent versus how they benefit, they found that 68% of businesses saw a return of at least $1 for every dollar invested. They look specifically at transportation, manufacturing, construction. So for manufacturing, On average, it was about $1.24 that they benefited, 24 cents on every dollar invested in health and safety. Now, this study was implemented with businesses that had a good health and safety history with more than 100 employees. We're going to make the assumption, though, that these types of benefits, especially those intangible ones like employee morale, production quality, and strengthening reputation, would apply to all business sizes. So let's talk a little bit about how you can invest through WSIB's health and safety program. Brett's going to talk to you a lot more about that. Just so you know, part of our mandate is to promote health and safety in Ontario workplaces. So this is why we've created this program. Um, Keeping people safe at work is really important to us at the WSIB. We're well trained and equipped to help anyone affected by an injury. But again, like I said before, we'd much prefer that you don't get hurt in the first place. So we're going to do what we can to help people avoid work-related injury and illness. So let me tell you a little bit more about how the Excellence Program works. There's 36 topics in the program across 3 levels, and this is going to help you build a robust health and safety management system that is aligned with the Ministry of Labor, Immigration, Training, and Skills Development Accreditation Program. You won't be doing this alone. Brett's going to talk to you a lot about how the providers are going to help you implement topics. And when I say a topic, I don't mean like a training course or something like that. This is really where you pick something to work on and you take it and you implement it in your organization. You customize it, you tailor it for what makes sense for you. It's very flexible. You've got 36 topics to choose from. You can do up to 5, usually in a year, or what we say is an action plan cycle. And you really can implement the topics the best way that suits your business. So if you're just getting started, you don't have any policies in place, not great at health and safety communication, you would start at the foundation level. If once you get beyond that, you're already at the intermediate level, you might start to want to work on things like emergency preparedness or return to work. And then if you're already at an advanced level, there's 9 topics you can choose from, like audits, like corporate social responsibility. There's lots of options here to really suit where you are in order to build and then maintain an occupational health and safety management system. So there's lots of benefits to the program. The program was designed to meet legislative health and safety requirements. So these are things you have to do anyway. You're going to get a badge. It's going to help strengthen your reputation. Like Luis mentioned, rebates will be of very interest, and I'm going to talk about that in the next slide. And bottom line is really keeping your employees healthy, happy, and safe. Now, for a limited time right now, we have a rebate promotion going on for smaller businesses where you can actually get double your rebates, as well as $1,000 towards provider fees and services. So if you have less than 100 full-time equivalents, you're going to want to look into this program for sure, because again, right now until December 2023, you can get double rebates and $1,000 towards working with a provider like Aon. So this is a small business example of what your rebate would be. So it's all calculated based on your prior year premiums. So this is an example of a company that completed 3 topics. We use something called predictability to have the calculation. So we know that rate's around 2% for a business that has a low predictability. That means how much can they influence their class rates or their individual rates. So 2% of $7,000 is normally 140. I hope I did that math right. However, we do have a minimum funding floor of $1,000 per topic. So for this particular organization, 3 topics at $1,000 each would be $3,000 in a regular year. It's doubled up till December 2023, so that would mean $6,000 back for completing 3 topics, implementing them in your organization, plus $1,000 support. So the total financial support is $7,000. Now, if you're a large business, you still get a rebate. It's just not double the rebate. So we're looking at a large business here that paid, let's say, $150,000 in premiums. They've completed 3 topics. Their predictability is high, so their rate's a little bit less at 1.4%, which gives you $2,100 for 3 topics, which would mean total financial support, is around the same. So it's around 6,300. So you can tell we're really trying to incentivize smaller businesses, again, those less than 100 employees, to really engage and participate in health and safety, but we want to be able to support large businesses as well. So before I finish here and let Brett speak to you, just a testimonial from Longos, who is a member of the Health and Safety Excellence Program. So they say that the program is now part of our day-to-day routines. It has helped us to prevent injuries. Last year was one of the strongest years we've had with the decrease in our injury frequency rates. We've also seen a remarkable improvement in employees' approach and attitudes as we develop through our program and topics. You can't get a better testimonial than that. So I'll pass it over to Brett now, who's going to tell you about how providers support this program.
Wonderful. Thanks, Vanessa. And thanks for having Aon on today to the Meat and Poultry Ontario. Just wanted to, before I roll into the slides and tell you a bit about Aon and providers' role within the Health and Safety Excellence Program, just wanted to introduce Robin Dadar, who's based in Mississauga, Ontario. Robin, you want to give a quick wave? Robin's been a senior health and safety consultant with Aon for over 23 years. So welcoming Robin. He works with a lot of our clients. So just on the next slide, a little bit about Aon. So again, thanks Vanessa for a great overview of the benefits of joining the program. Certainly at Aon, we see great benefits to businesses in joining right now, particularly small businesses with double rebates available and whatnot. So I'm Brett Christie. I lead the casualty risk consulting team at Aon. We're proud to be a provider of the Health and Safety Excellence Program, working with WSIB. In the next few slides, I'll help you understand a bit more about Aon and how our Health and Safety Consulting team helps clients navigate the Health and Safety Excellence Program, put in place effective safety programs, and improve your business. So I recognize that not everyone has potentially heard of Aon, so I wanted to start with a little bit of an introduction about who is Aon. Aon is a leading global professional services firm providing a range of risk and insurance, as well as retirement and health and benefit solutions. We're a firm of about 50,000 colleagues in 120 countries, working to empower results for our clients. On a local scale in Ontario, we have offices in Toronto, Burlington, Windsor, London, Thunder Bay, and Ottawa. We grow our business by helping clients grow theirs by providing sound risk management services and advice through a dedicated team that's focused in nearly every industry segment. As you can see, Aon has a large client base in food and agribusiness segment. Where my team fits into Aon and helping clients is in the risk control area, as Luis mentioned during the introductions. Our team helps clients prevent losses, and specifically our OHS consulting team works to help clients put in place these systems like Health and Safety Excellence Program in their workplaces to reduce injuries and illnesses. On the next slide, you can see where our footprint is in Ontario, all of our different offices, and I'll just really quickly give you an overview of our different divisions. So Robin and I, we're part of Aon Global Risk Consulting. So that's a worldwide consulting organization focused on all of the different areas you see below that title. And casualty risk consulting, specifically occupational health and safety consulting, is where Robin and I spend our day-to-day time with clients. We also do fleet safety consulting and premises liability consulting for clients. The other primary areas of Aon are Aon Commercial Risk. Aon Commercial Risk is our insurance brokerage, and we help businesses obtain the best insurance at the best price. Our other division is Health and Benefits at Aon, and that provides consulting and tailored solutions to mitigate rising health and benefit costs within your benefit plans for your company. Aon Wealth is involved with helping organizations on their pension arrangements and investments. We don't look after individuals, but we look after company pension plans, endowment, and that kind of consulting. So that's a very broad brush of what Aon is all about, but all of that revolves around risk, business risk, and helping clients navigate that. At AGRC, or Aon Global Risk Consulting, like I said, Robin and I are really focused on the casualty risk consulting. So if we go to the next slide, we'll now that you know a bit about Aon, we'll focus into our occupational health and safety consulting area. So each of our consultants at Aon really bring with them over 20 years of health and safety consulting. We have helped clients of all different sizes to put in place programs or help them with training or auditing or any area of occupational health and safety. Our team is specifically made up of only registered safety professionals that have passed the Canadian Registered Safety Professional exams and have worked in the field for many years. I had the pleasure of spending 14 years of my career before joining Aon in the ag industry, implementing and building health and safety programs for a large ag business in Western Canada. And I've been with Aon now for 15 years doing health and safety in many different industry segments along with Robin. Why do we do what we do? Well, simply put, we know that the work that we do and well-designed health and safety management systems are good for business, as Vanessa was showing you. We know that through our work, we help reduce the financial losses that occur due to injury, and moreover, we help you to attract and retain workers, which in your business right now is a struggle. Like you, we want all your workers to get home safe at the end of the day. That's really why we chose this profession. So we look forward to helping those of you that want to choose us as your partner and getting to know your business and helping you implement the Health and Safety Excellence Program. So a bit of history on Aon and our work with Meat and Poultry Ontario. Had the pleasure of meeting Franco and Luis and the team. Through the period of COVID, Aon was contracted to work on a project called Workplace Safety and Technology Innovation. And in that, during that project, our casualty or occupational health and safety team had two primary phases of work. And the first one was doing occupational health and safety gap analysis of about 5 or 6 businesses that are MPO members to identify any gaps that there might be in health and safety programs at those companies. Not to specifically look at those individual companies, but really to see what are the trends or the gaps in health and safety in the industry through a sample look at different businesses. So we looked at abattoirs, we looked at some meat processors and different member businesses. The second phase was developing occupational health and safety management system template of policies, procedures, forms, inspections, etc., to help Meat and Poultry Ontario members. And now, I guess, as we've put in place that program through COVID, the health and safety management system template, that program's in place, it's ready to be deployed. And as a newly approved provider of the WSIB Health and Safety Excellence Program, we're now ready to help members implement that program into their businesses and achieve those rebates that Vanessa spoke about. So this is the next logical phase of work between Aon and the MPO members, would be to register employers into the program and get you into the Health and Safety Excellence Program. On the next slide, just some of the gaps that we were able to identify. Some of these are more specific gaps in health and safety programs that we saw. But overall, we do know that through our study that there is certainly room for improvement in the industry to put in place this Health and Safety Excellence Program, and there's opportunity for improvement to help the members. On the next slide, we can see some of the top risk areas that we identified through our assessment. Sorry. Our assessments also identified some of the top health and safety risks: sharp tools, broken glass, slippery surfaces, ladders, overexertion, unguarded machinery, sprains and strains, and COVID transmission, of course, through COVID was huge for all of you. And so we've become familiar with the health and safety risks for Meat and Poultry Ontario members. We've built the program. We're really ready and at that stage now to implement that program. So on the next slide, I'll just quickly show you what the elements are that we've built that are ready for you. It lists on the right-hand side the table of contents of the health and safety management system, or safety program, if you will, that's available to MPO members, plus a whole bunch of other elements that we developed as part of the program that are on the left-hand side, all the bullet points that are there. And so at this stage, I want to walk you through the WSIB's Health and Safety Excellence Program 4 steps. So how can we work together? And the first step is obviously to join. Enroll using a unique Aon link, which I can send to you after we have a discussion following this webinar. Give me a shout. Talk through your business. If you say you're interested in this program, we have a unique link and we can help you walk through the registration process to get you joined. There's also a development phase, and in that development phase is really where Aon works with your business or yourself to pick 1 to 5 topics, and I'll show you what all those topics are in a minute. But we help you to develop an action plan to submit to the WSIB into their digital portal. And we walk you through the process of selecting those topics and also putting forward those action plans. Once those action plans get approved, we work together to implement the health and safety policies and customize them for your business, because we know that there's not a one size fits all for clients. You can't just take a policy and procedure off the shelf and hope that it works for your business. You need to customize it and implement it, train your people. So there is work to do at your end to implement the different topics, and there's certainly work to do for the providers like Aon to coach you through and facilitate through that process. After we get the topic implemented, we then need to provide an evidence submission to the WSIB's validators. And what that means is that we put together the evidence story. We say what we've done, what we've implemented, how we've impacted change, and whatnot. And Robin and I would work with you and your business to put together that evidence package and submit it through the WSIB's digital tool. And then it goes to a validator at the WSIB. Now, we will pre-audit your submission, make sure your evidence meets what we believe the validators will be looking for, so that when they look at it, there shouldn't be too much more to come back to us with. But if they do come back, Robin and I would be working with you to fill in any loose ends, make sure that the topic is fully met, and resubmit that for validation. Once the topic's validated, like Vanessa mentioned, you're eligible then for the rebates. And depending on whether you're small business or large business, those rebates can be up to double this year, particularly small businesses. There's that double rebate available. So that's how we work together. There's a really slick digital tool that the WSIB has in the background, which really helps walk us through providing picking the topics, developing them, demonstrating the evidence packaging, and then getting to those rebates. So it's a very organized process. On the next slide, and Vanessa, you chime in anytime, there's about 36 topics here that you see on the screen. 10 topics are at the foundation level, 17 topics are at the intermediate level, and there's about 9 advanced topics. And really, as you enter into the Health and Safety Excellence Program, there's an assessment that we do, that you do in the digital tool, and we can work with you on that. to really assess where is your health and safety program at right now. If you have no program, then you're probably starting at foundation. If you have some program, probably starting either finishing up foundation or moving into intermediate. And if you've had a program in place for quite a while with all these different elements, maybe you're in the advanced area. Aon's able to work with you on wherever you fit into the different levels, whether it's foundation or whether it's intermediate or advanced. Vanessa, anything to add on that slide?
No, just it is all part of a roadmap. So just one thing to mention, if you are at an advanced level and you're working towards being accredited through CORE or ISO or other accreditation bodies like that, you can also move towards the pathway to being recognized through Ontario's Supporting Ontario's Safest Employer program. So the whole reason we've developed this is it's intended to be an ongoing journey. So not just a one and done, so that when you enter year one, wherever you are, to know that you can keep moving along with Aon along the pathway to year after year build your management system.
Right on. Thanks, Vanessa. And on the next slide, just to kind of recap some of what Aon does to simplify the journey as we work with you, really topic selection assistance, helping you understand which topics might be good ones to start with after we've, got to know you a little bit more and where your safety system's at. But our goal is to meet you where you're at and then pick topics to move you forward. We help with the action plan development. There's a wonderful tool on the WSIB site for safety culture survey and reporting. You can get a safety culture report and survey your organization, which allows you to benchmark safety culture at the beginning of your journey and also year after year as you go through your journey. So that's included. Policy and procedure template support and guidance. I showed you a slide there that showed the safety management system that Aon built for MPO. We would take that and work with you to tailor that system to your business. We'll help provide and connect you to training, either training that we have or training of other providers, and make sure that we get your workforce properly trained on the different topics and areas. And we can do that through classroom at our offices or at your shop if you've got a little meeting room, or we can do that virtually, of course, like we're doing now. Site visits and surveys. We want to come to your business, see your operation, get to know you on a one-to-one level, understand your business and challenges and sort of how robust a safety system you want to have in place and kind of meet you where you're at. Monitoring your progress, obviously working with you to do check-ins and monitor regular meetings with you to check on progress and keep things going and encourage you as you go through the process. Tracking your process within the digital tool is another key thing that we will help you with until you're familiar with the digital tool and experts at it. And just ongoing support. Questions, answers, guidance, legislative interpretations. I mean, Robin and I, we live and breathe the Act regulations at a minimum in our work. So we'll be able to help you understand it, make sure your supervisors understand it, and sort of take you from that compliance to really injury prevention journey. We also have digital technology available to those members that really want to, a slick system. We have a program that can allow you to do everything on your iPhone. You can do your inspections on your iPhone. You can do, house all your policies and procedures on this portal. There's even an asset tracking module that's part of it, which will allow you to track all your preventative maintenance. Happy to give you anybody on the line here today a demo of that digital technology platform as well. Anyways, that's a start. Through April at MPO, we will send you on the next slide. We will send you a a service listing so that you can understand more about what Robin and I do day to day for clients. It's our AGRC Casualty Risk Control Services listing, which talks about our OHS, fleet safety, and premise liability services. And just on the last slide, the next steps to working together, really just contact Aon. Give me a ring. On the next slide, we're going to have, our contact information. We'd like to discuss, discuss your goals, where your program's at, help you with picking the topics and understanding what our fee would be to work together. And then getting you registered with Aon into the WSIB Health and Safety Excellence Program through our unique link, which we can send to you. Takes you, you click this link I send you, it takes you to the digital portal, and we work together to register your business into that, into the Health and Safety Excellence Program, get you started. So on the next slide, just some contact information for myself and our health and safety consulting at Aon email address. Feel free to either email myself or that health and safety consulting email address if you have questions. We'll set up a time to talk and go through how we might be able to help you. And with that, I guess I turn it back to Vanessa and to Luis to sort of take any questions that may have come in.
Thank you, Brett. Thank you, Vanessa. This has been very, very interesting. I think that there's a lot of value in this program that WSIB has developed. I think a lot of companies can benefit from it for sure. I don't see any questions in the chat. Are there any questions from the audience, from participants? You can use the raise hand button at the top of your screen if you have a question. If you don't, I do have a question for you, Brett. Mm-hmm. And I know you've gone through a lot of this already through your presentation, but let's say I'm the owner of a very small meat processing operation with 25, 30 employees. I believe this program would be very good for my company and for my employees. And I would like to benefit from the program. But really, I don't have a person in charge of health and safety. And at the end of every day, I'm very tired after, physically working, in my operation. Can I still do this? And how can you help me? How can you help me get through this and benefit from the program, which I really want to?
100%, Luis. Great question, and really representative question for the membership, because we do know there is a lot of small businesses within the portfolio. Really that's where a consultant comes in invaluable. Robin, myself, and Aon, and other providers of this program, they really know health and safety well. Much like the owner knows, meat processing very well. And so really we work to make it simple for that business owner to go through the steps, right? We help them pick the topics and do all of those things that I showed you in the presentation, and try to make it easy for them and be very aware of their time. We know that they have limited amount of time. And so being really careful of their time, really, they can work with us so that we take on a lion's share of the work. But at the end of the day, there is effort required from the business owner. I can't sit here and say that there's no effort required of the business, but I can say that really our job is making it simple. All the tools, templates, training, and everything that's needed, it's really just keeping that owner who's trusting us to help them implement aware of the steps that we're taking. And I think the owner really would have a role in coordinating, right? Bringing together who needs to be trained, and then rolling them over to Robin and I to connect them to the training. Or picking the topics with us initially, and then we're providing those templates back to the owner. Owner then has to spend a bit of time reviewing them. We then coach that business owner through the elements that they need to put in place in the business and give them an idea of what that looks like, and really we're facilitating the whole process so that it's made easy for that business owner. And so I think, without having to hire an expensive health and safety full-time equivalent onto staff, through some consulting work and with the benefit of the WSIB's Health and Safety Excellence Program, all the resources are there for that small business owner to tap into really excellent expertise at a fraction of what it would cost to put somebody on staff.
Excellent. Thank you. Thank you, Brett. Robin, you had something to add or another question?
Yeah, something very quickly to add to that. One of the slides that Brett showed earlier showed that 60% of all small business of MPO people do not have a health and safety person or somebody in charge of it. So we kind of know that's there. That's where we fit in to help you as a trusted advisor and work with them directly and understand that.
Yeah, thank you. Any other questions from participants? Being none, then yeah.
We'd really like to hear your questions.
Yeah. Yeah.
Okay.
Okay, I'm not seeing anything. So I want to thank you both, Vanessa and Brett, for your time. Oh, there's a question here.
There's a question.
Sharon? Yeah, Sharon, go ahead.
I'm just wondering, in the entry level, like the just getting started, your foundation, is there any translation services available for the employee training portion of it? We have about half of our staff would be Mexican. There's not a lot of English comprehension.
Yeah, we can work through that. Certainly, the policies and procedures can be put into Spanish, and certainly we can work with interpreters to ensure that the information is conveyed in different languages. If you're asking if Robin and I speak Spanish, we don't, but we did work in Korea on the Lotte World Tower together and did 10 trips overseas working with South Koreans with an interpreter. So we have done that before, and it was quite successful helping the Lotte Corporation over there in Korean.
And I'll just add something to that too, and because we've seen that before, and even just taking on a topic like health and safety communication, where that becomes a project in itself to figure out how to communicate in the best way in not only plain language, but also in different languages. So it's something that we've seen other organizations do as well as part of the Health and Safety Excellence Program.
I think the last thing that I would add to that is that our online training is available in Spanish, French, English, German, multiple different languages. So there is a lot of the training aspects available in Spanish.
Thank you.
You're welcome.
Thank you for your question, Sharon. Thank you for your question. It actually triggered another question for me, for Brett. I don't know what the situation is in Sharon's company, but we could be talking about permanent staff with language challenges, or we could be talking about temporary staff. So people who are here this year but won't be here next year. It'll be different people next year. How do you address that?
Well, it's not a new phenomenon to me. I mean, it's people come and go, and you have to make sure they have the training to work safely before they're out on the work floor. I've seen a lot of employers wait to do training until somebody joins them on a full-time basis, and unfortunately, sometimes those injuries occur through a lack of good communication. Before any decision on that employee's full-time basis has been decided, but they end up on your workers' compensation, raising your premiums and impacting your rates. And so I guess the only answer to that is that I have, Luis, is just the importance of ensuring that everybody gets the information and training, and that means that we have to do multiple rounds of training. We have to do a lot of onboarding with new people that are starting, and we have to meet them in their language, as we've discussed with Sharon's question. So,
yeah.
But Robin and Vanessa, anything to add to that?
Yeah, I
Yes.
mean, I've seen that quite a lot in the ag industry with temporary migrant workers. We do have resources for on WSIB that are in different languages for them. But I think one of the key things here with those populations too is not only the training, but also giving them that empowerment through understanding their health and safety responsibilities to be able to bring, recognizing different hazards forward. And if they are feeling like they're in an unsafe environment, that's one of the key things as well with that population. I think that would help with what Brett was talking about, not only training, but just empowering them that to avoid injury and illness.
Yeah, I was just going to echo what Vanessa said. The Ministry of Labor a couple of years ago developed training in WMIS, especially in at least 15 different languages, as well as brochures, handout books, and stuff like that directly. So that is around, still available, and those translation services are still available through the ministry. So that they are still there. Just have to get enough people in the group to do it, to make it worthwhile, but it is still there. So I know I was one of the trainers actually I was in 2 different languages, obviously English, but also did it in Punjabi and also did it in French. So I know there are other people that did that too directly.
I think the other thing too, Luis, to that question is we can do things as a group at MPO. We know that there's similar challenges at all the different businesses within your membership. And so if we know that there's going to be a large hiring done of immigrant workers, right, that are coming in at a certain time of year, what we could do is put on sessions and orientations to the general safety hazards of the industry that would be applicable to all of the members that may sign on to the Health and Safety Excellence Program. So we can certainly do things as a group for those members that do sign on with AON and into the Health and Safety Excellence Program, where all of those workers come together. We do a group training session for those people, and just anything where the members say are going to want to work on the same topic. They all need foundational topic number 1. Well, we can arrange regular webinars around those topics, regular training around those topics, and do it as a group so that the members are able to meet together and share their successes with each other, and really AON facilitating a group approach to health and safety excellence to move a group forward through the program as opposed to company by company. Certainly was expecting that we would maybe end up doing that with such a large membership. If we have 10 or 20 small businesses that all need the same thing, we could tackle it in a group manner and agree on how to do that.
Excellent. Thank you, Brett. Any other questions from participants? Okay, so thank you very much, Vanessa. Thank you, Brett. Thank you, Robin. It's been a great session. Lots of valuable information for participants to share and to learn from. So thank you very much again. And I hope that we see some good engagement and responses from MPO members and other companies. So thank you. Thank you, everybody, for participating. We appreciate your participation and look forward to seeing you again in our next webinar. Thank you and goodbye.
Thank you, everybody.
Bye.
Thank you.